He never rolled over, and that should have happened months before. He wasn't sitting up, so I took him back to the doctor. The doctor was like, well, he might be a late bloomer, or I don't know. And I said, well, I really feel like we need to do something. So they ended up sending us to a pediatric neurologist at University of Maryland who wanted to do a battery of tests, did an MRI. It took a while to get those results back. So by the time we finally got a diagnosis, we went back, and that day everything changed for us. He said, well, we've got good news and bad news. The good news is we have a diagnosis. The bad news is it sounds very scary, but it's, excuse me, sorry. But the diagnosis is going to open a lot of doors for you. He has cerebral palsy, and we don't know yet how affected he is and how affected he'll be. We didn't have tons of extra money, and we were both working full-time. Health insurance was very, very expensive. And we realized within the first 3 months of his diagnosis that I had lost more money trying to get him the care he needed than I made that entire year. And we couldn't get him insured at this point. We could not find any policy that would take him. And if there was a policy that could take him, it was in the thousands of dollars a month. And the pediatrician asked us if we had heard of state children's health insurance program, and I had not. So I did homework, I found that number, and lo and behold, there was a program that offered him health insurance. And it was the state Medicaid program, which we were financially eligible for. And it was through an MCO. And we chose the one that we thought might have the best coverage for him. And that was Maryland Physicians Care. And from then, insurance no longer became an issue. He never missed a treatment. And there were a lot of treatments. There were a lot of braces and a lot of treatments. And we really started seeing his progress. He was turning out to be a different kid. By 2.5 years, he started walking. And then he seemed to really just, to really take off from there. So that diagnosis of cerebral palsy really was a blessing. It was a gift to us. And having health insurance was the most important piece of where he is today. He's really found a niche in his academics. I'll brag just a minute. He actually graduated as valedictorian, and he is now in med school.
I'm a first-year medical student at Penn State College of Medicine. I think that, I was able to see what medicine can do, firsthand. I went from not being able to move my arms and legs as a kid to, being able to do everything that a normal kid could do, all because of medical intervention. So it showed me that it worked, and it showed me that it was really something that, it was a noble profession, and it was something that I wanted to get involved in. I've seen, just based on where we are, a lot of the time to get quality care, you need to go into bigger cities and that sort of thing. And so I think something that I'd really like to do is sort of stay in a more rural area as a primary care physician, because I know that those areas are ones that are particularly underserved.
It's really quite a miracle. And the moral to the story is, had all of these people, from the insurance company to the doctors to the pediatrician, had they all not invested then, he would have been a very different child. The investment that we collectively, the community, was able to make on him is allowing him to be able to do the things that he wants to do, which also happen to be to give back the way that things were given to him. Whatever his potential was, that's all we wanted. And he certainly has far exceeded my expectations.
I'm absolutely very incredibly grateful for my family and the programs that they found.